Hey everyone, welcome back to another video. What would you do if your kid was fat? What questions would you ask? How would you intervene? We're not talking about like a little overweight, but if your child was actually very fat, like obese. The reason we're asking these questions, and that's going to be the topic of our video today, is because the American Academy of Pediatrics just released their 2023 guidelines for treating obesity in children. And they stirred some controversy. Now, within all of that, you had the typical, behavioral interventions, possible counseling, diet changes, lifestyle, like that's all good. Where the controversy came into play is that they also said that once your child is 12 years old, they should be evaluated for potential pharmacotherapy interventions, which are weight loss drugs.
And like then phentermine or...
Yep, exactly. Or even orlistat, which gives you diarrhea and prevents you from absorbing fat. There were a variety of them, like at least 7 off that I can remember off the top of my head.
Yeah.
And then they went above and beyond that and said now if the child is at least 13 years old and if they are morbidly obese, like 120% above the 95th percentile for their weight, then they should be eligible for bariatric surgery. Now, obviously, weight loss drugs and surgery are going to stir controversy, and for good reason. And we basically just wanted to give you our thoughts on this whole thing, because both of those interventions completely miss the boat, in our opinion.
Yeah, especially for children. I do want to clarify, we are not anti-drug. I'm more on the side of bariatric, just because of the long-term effects and cross-addiction.
I don't think a child should get bariatric surgery, period.
No.
That's a life-altering surgery.
But I am talking about even adults. Adults, I'm very, pro-drug if other aspects are addressed simultaneously, right?
Yeah, definitely, both of us. Well, why don't we start with bariatric surgery, because that one's the most kind of out there. So you're gonna, chop out part of the stomach of a child just because they are morbidly obese, and they're going to be stuck with this the rest of their life. Based on, clinical data in adults, they're probably going to regain most of the weight because you never address the underlying habits that cause them to become fat to begin with.
Yeah, and the data we have shows cross addictions. Yeah. That's the problem in those formative years when they're exposed to drugs and alcohol, and they're probably going to develop a way worse addiction.
You do not become morbidly obese without having an addiction to eating. There could be a lot of reasons that you use to justify that addiction. Trauma, stress, whatever. People do not become obese, or morbidly obese, I should say, without them having an addiction to eating very hyperpalatable and calorie-dense foods. Yep. So bariatric surgery doesn't address the underlying cause at all. It's just a Band-Aid saying this'll prevent you from filling your belly up as much as you can.
And it's going to manifest in other areas.
Exactly. Addiction transfer. They might develop an eating disorder. They could start being bulimic. They could actually flip on the other end, start becoming anorexic with excessive exercise.
I would be more cautious about alcohol and drugs at that age, though. Mm-hmm. Because all of us know that. Yep. That's usually when we experiment with that stuff, and
Yeah, exactly. And then weight loss drugs are similar, but they're a step below, I would say, because obviously you're not getting life-altering surgery. You can stop the drugs at any time. But the point remains, they aren't actually addressing why is your kid eating so much that they are obese.
Yeah, there's a lot of psychological underpinnings that are being left out. Most children that is, binge eat to cope with a stressful environment. If you're not fixing the stressful environment and taking away their coping mechanism, what the fuck are you gonna give them?
Yeah.
That is so harmful to those babies. I still think of them as babies when they're...
Yeah. Yeah, and so Also, a lot of them, for the same reason, it's a coping mechanism. It might not be because their environment is stressful, but it might be from past traumatic events that they had to undergo. And now whenever their nervous system becomes activated for whatever reason, and they start their body literally remembers these traumatic events, it's stored in their nervous system. Yeah. They go to food to comfort themselves.
Yeah, and well, back to the stressful environment thing, we do know that children that are obese and overweight, they have a really high risk score for being molested, sexually molested. So, like, if they're still in that environment, what are you gonna, like, it's just so strange.
Well, it's
to
like
me.
It's taking away their safe space, so to speak, and throwing them back into the lion's den.
All they know is that food makes them feel better.
Yeah. And
That's all
now
they
you're
know.
going to take that away.
And if they're really young, because we're recommending this for like 6-year-olds, right? If they're really young, then what are they going to do? They can't go to drugs and alcohol like a teenager, like, to cope with these new things. It's just so strange. And telling a child too, like, I'm sure there's medical professionals that are like, we're giving them psychotherapy. Oh, 3 sessions? It doesn't work that way. It doesn't.
Yeah.
It's like habitual behavioral.
Yeah. Basically, our position on all of this is that there's a lot of children out there that are overweight and obese. That's undeniable. But, the question needs to become why. And the primary causes of why actually has, like, nothing to do with them. They're children. They're completely at the mercy of their environment and their family.
Blank slates, pretty much,
Yeah.
other than genetic inputs, which does occur. In my moderation blog post, I talk about certain people with SNPs and, like, dopamine and endogenous endorphins. That's why Contrive works so well for obesity, is for these people. There is that component to it, right?
Yeah, but, I mean, genetics also are impacted by the environment. So people might be, like, for example, you have, like, every obesity-associated gene there is.
Every single one.
And
And I can eat.
yeah, but she manages that by having habits in place that prevent her from becoming obese, like eating a predominantly plant-based diet, high-volume, low-calorie foods.
Drugs and surgery do not address habitual behaviors in the environment and setting yourself up to win.
Yeah.
I really don't like the whole you're not empathetic if you don't give them drugs and surgery bullshit too. Like,
Yeah, I agree completely.
I'm like, what? Like, maybe you're the one that's not empathetic because you're ripping their coping mechanisms away.
Yeah, it's
by giving them drugs and surgery.
Exactly. Once you get below the surface, that should become obvious.
They're going to go to something else.
Yeah.
You're not fixing it for them.
Yeah, and so, coming back to the questions we asked, like, what would you do if your child was obese? What questions would you ask? For all the parents listening, for who's that the case, you really just need to look inward. You need to look at yourself as the parent and the environment that you're creating for the child, because, again, it is not their fault for becoming obese. They don't have the same autonomy and prefrontal
Impulse
cortex
control.
activity that an adult has. They just go with what feels right most of the time. And so you need to create an environment that lets them feel right without needing to eat all the food they can.
Yeah, and I think that you need to work with a good, like, psychotherapist if your child is binging that way, because it might not be the parent at all. It might have been, like, say with, like, child molestation or something, it could have been, like, a camp person or, like, you don't know who was traumatizing your child, but there's something under the surface that they're trying to cope with.
Yep. And then, just for completeness, there might be children who aren't coping with anything. It's just that all the food you're giving them is very hyper palatable, and we know that promotes passive overconsumption.
Yeah.
So you gotta look at the food you're bringing into their environment too.
Usually people don't get obese from that, though, even children. They'll get over fat.
Yeah, that's a good point. They don't get obese, but they'll like, be on the chubbier side.
Yeah.
Yeah, great point. Anything else?
No, I think that's it.
Okay, awesome. So yeah, that's our thoughts on this whole situation. Thank you for listening.
Let us know your thoughts.
Yeah, let us know your thoughts.
We're always down for a spicy
conversation.
Yeah.
And share this video around if you enjoyed it, and
like
it, and if you haven't already, please subscribe to our YouTube channel.
Bye.
Thanks everyone. Bye.